So thinking a lot about why patients deteriorate and how this gets missed. And I think sometimes a lot of nurses expect that a patient is going to suddenly crash. But in reality, patients actually deteriorate over hours, right? Like they don't crash quickly. And so, what is your job in nursing when we're looking at patients who are doing this? And part of that is to really understand that you have to notice the pattern, right? So today I'm going to talk about clinical pearls that help you to notice the patterns for your patient, hopefully to catch things before they happen or before they surprise you at least. So the first one is to look at your patient before you look at the monitor. So what are you doing when you walk in the room? Obviously you're looking at your patient. So what do I mean by look at your patient? I mean, actually look. What are you looking for? Walk into the room. Look at the patient's face. How do they look? Do they look comfortable? What is their facial expression? Do they look like they're in pain? Look at their posture. How are they sitting? Do they look like they're favoring one side over the other? Or are they sitting very upright and forward, trying to breathe better? And can they finish a sentence, right? So what are they looking like? How are they positioned? What does their face tell you? Those are the sorts of things, first look, that you need to look at. Okay, so that's your first piece. So even if you have the monitor, you want to make sure that you look at the patient. Sometimes the patient will tell you things long before the monitor does. The next thing we want to look at is like the work of breathing. Work of breathing is visual. So we want to look at accessory muscle use. The only way to see accessory muscles is to remove the gown, the t-shirt, whatever it is. And so when we go to assess the chest and the work of breathing, we want to make sure that we're looking at accessory muscle use. So we have a few accessory muscles, the ones in the neck here on either side. When they get going, you know your patient's really, really struggling. So if you can see them up here, you know the rest of the chest is working really hard. So the subtle signs are going to happen in between the ribs and not up here. So if you see scalene muscle retractions up here, your patient's really, really struggling. What you want to catch is when there's just a little bit of intercostal indrawing below the rib cage or in between the ribs. And so what's their abdomen doing, right? Are they using extra abdominal muscles to breathe? What are their shoulders doing? How about their nose? Are they doing any nasal flaring? So those are all things that you're looking for. So when we talk about assessing patients and going through the ABCs, your B means you have to actually look at the chest. You can't just look through a t-shirt, a sweater, a winter jacket, a patient gown. You have to actually get in there and look. So that is our next piece, right? Is that. The other thing is when you're talking to your patient, can they speak a full sentence? How many words can they speak in a sentence? Because you can't auscultate through a gown work of breathing. You might hear lung sounds, but you're not going to really know what their work of breathing is. So that's sort of pearl number 2. Look at the chest. Number 3 is, of course, the skin. Every patient is covered in skin, hopefully. And so this is where your ABCDE, E becomes super powerful. Expose the patient's skin and take a look at it. What are you looking for? Color. What is the color? Is there any pallor? Is there any cyanosis? Is there any jaundice? Is there any mottling? Is the skin diaphoretic? So are they sweating? What do the nail beds look like? What about the temperature of the skin? So I understand you're going to take your patient's temperature, but what does the skin temperature tell you? The temperature of the arms compared to the temperature of the legs. Again, if you don't expose the legs, how do you know what color they are? How do you know what temperature they are? Don't forget looking at things like cap refill. Most people remember to do cap refill on the fingernails, but what about the toenails? It's great if you have good cap refill in your hands, but if you never look at their feet and never assess it, how do you know they have circulation to their legs? So sometimes the skin actually can tell you way more than a blood pressure can tell you. Pearl number 4 is trend, don't chase numbers. So respiratory rate. So first of all, to count a respiratory rate, you have to expose your patient. You have to actually count it you can't guess. Your guess is going to be wrong. You're going to miss subtle changes. If you start your shift and you count a respiratory rate of 16, and then you go in later, they look a bit different. Now it's 18, then it's 20, then it's 22, now it's 24. That's significant deterioration. What if the overnight staff said it was 12 when they were sleeping and you go in and it's 22? That's a significant deterioration. So we're looking for a trend in the numbers, not just the number itself. So is it trending positively or negatively? And you can trend all of your vital signs: heart rate, respiratory rate, blood pressure, oxygen saturation. Take a look not just at the number, but at the trend. What is your patient vitals telling you? And then match that with your actual visual inspection and assessment of your patient. And then the last thing to consider is, if something feels different, trust your feeling. Assess it, expose it, gather your data, and escalate early, right? If you think, oh, I just don't love what this looks like, but I don't have anything specific, my vital signs look okay. Okay, you're not waiting for the perfect storm. That's already too late. You want to look at this by the time, okay, so my patient has some increased work of breathing. Right now, their oxygen saturation is okay. Their respiratory rate is slightly increased, but definitely I can see that there's intercostal indrawing. So I'm going to let somebody know this is happening, right? So you are recognizing that something has changed and you're trying to intervene early. You're not trying to prove that the patient is deteriorating. You're trying to prevent them from deteriorating. So those are my pearls for today. Hope they're helpful.